I just got my hospital bill. I was in there for 3 days for a leg surgery, and I'm going to read you the itemized charge list. First, semi-private room and bed changes, $12,487. Changes for drugs and IV solutions, $2,222. Medical surgical supplies, $2,918. Clinical laboratory changes, $5,314. Operating room charges, $7,749. Anesthesia services, $2,157. Physical therapy, $874. I literally had no physical therapy. I had surgery and I walked with a nurse when I got out. And I was the one who said I wanted to walk on my own. I literally held some random nurse's arm. Emergency room services, $5,615. Recovery room services, $1,948. For a total of a whopping $41,288. Free that boy.
How can I help you?
So I think there's a mistake on the bill, but maybe you could help me out. We got a bill, and then we realized that you guys didn't have our insurance, so we sent you the insurance, and it looks like the bill went up.
It went up?
Yeah, the first bill we got without the insurance was $600, and then the second one was almost $1,300.
Okay. Yeah, so that the first invoice you received, that's a discount that you receive if you're uninsured. So you're not eligible for the discount since you are insured. And so the bill was $2,342.14. We billed your insurance. Your insurance only paid $1,078.85.
Can I go back to the discount without the insurance?
No, sir, you're insured, so you're not eligible for the discount.
If I go cancel my insurance, am I eligible for the discount?
No, sir, because we checked eligibility and you do have active coverage for data service.
Oh, I needed to cancel it before I got the service to get the discount.
You're only eligible for the discount if you're uninsured.
Okay, so I'll get cheaper healthcare if I'm uninsured.
If you're uninsured, you're eligible for the discount, correct?
Is this common? Like I pay for insurance and I end up paying more out of pocket because I pay for a premium? That's wild.
No, this is just a new law that passed or started 2024 AB 716, and the law is if you receive a discount if you're uninsured.
Okay.
So when we first send a invoice to the patient, we bill them as if they're uninsured. If you're insured, unfortunately, you're not eligible for the discount.
Okay, so just if I have the incentive straight here, if I want to pay less for medical care, I should cancel my insurance if my daughter needs life-saving medical care?
I'm not sure. I don't know, sir.
You
should cancel your insurance. I'm just letting you know that discount's only for patients who are uninsured.
Okay, that is special. That is a special law. So there's no way to put that discount onto an insured person. Only the uninsured people get that.
No, correct.
In my mind, insert cash or select payment type. Use PIN pad to complete transaction.
Hey, insurance. I could tell that I'm going to be running out of insulin soon. Can I refill my prescription now? No, you're going to have to wait until you run out. Oh, great. I ran out. Hi, doctor. Can you please send my prescription to the pharmacy for my insulin? Sure. Hi, pharmacy. Is my prescription ready? We never received it from your doctor. That's messed up. I'm all out of insulin. Let me give them a call. Hi, doctor's office. Why didn't you send my prescription for insulin to the pharmacy? I'm all out. Oh, whoopsie daisy. Our app doesn't work. But we want you to fill your prescriptions through the app. Can you please send the prescription to the pharmacy? Yeah. Hi, pharmacy. Is my prescription ready? I'm sorry, but we don't have your insulin in stock. Then can you send it to a pharmacy that does have it in stock? Sure. That'll be $800. What? Hello, insurance? What's up? Why is my insulin $800? Because we don't like that insulin. That insulin sucks. It's too expensive, so we're not going to cover it anymore. You have to use different insulin. More cheap insulin. Insulin not good for your body. Well, if I do the insulin that you like, will you give me more than just a month's supply? No! Why would we do that? This is the doctor's office. We noticed you're losing weight. Are you more stressed than usual? Not as stressed as I normally am. Every month. Well, you should really get a hold of your stress levels. And we think that the reason why you have all these other problems other than the diabetes is either because of the diabetes or it's because you're stressed and you have anxiety. So we're not going to look further into anything else that this could possibly be. Okay, love you, bye.
Hey man, how's it going? Well, I was supposed to do surgery today, but apparently I'm out of network, so the patient had to cancel. Out of network? What does that mean? It just means insurance won't pay for the patient to come see me for their health care. Oh, I didn't know you worked for the insurance company. What? I'm in private practice. I don't work for the insurance company. You sure? Of course I'm sure. So, when you see a patient, you send a bill to the insurance company, right? Yeah. And then the insurance company will pay you for your services. Yeah, that's right. Well, who decides how much you get paid? Well, you have to sign a contract with the insurance company. Well, what happens if you don't sign the contract? You don't get paid. Huh. So you do work, and the insurance company pays you for that work, and they pay you whatever amount they decide they want to pay you for the work you're doing. Yeah. I don't know. It kind of sounds like you're working for the insurance company.
Guess how much we pay for health insurance in California as a family of 4. But let me show you what's included first. As a small business owner, I selected Blue Shield of California because they have the biggest network and almost every good hospital is included, and even some acupuncture and chiropractic clinics. We have something that is called a full PPO, which means I don't need an approval to see a specialist, and I pay around $10 out of pocket per visit. And as you remember, I paid a bit over $2,000 for delivering a baby for a natural delivery. By the way, dental coverage is not included. We pay $787 for an adult, $520 for a baby, so in total for a family of 4, we pay $2,614 a month. How much do you pay in your country?
So we're in Valencia, Spain, and my wife got sick, and she'd been sick for like 10, 11 days. It's not getting any better, just really, really bad cold and flu symptoms. So finally I was like, let's figure out this Spanish healthcare and let's see if we can get you antibiotics or something. Within 20 minutes of deciding that we really need to get a doctor, she has her telemed appointment already scheduled and it started. The cost of this appointment is $29 with no insurance. We don't pay taxes. We don't have the benefit of free healthcare in Spain like a tax-paying citizen would have. But $29 to see a doctor effectively, or a telemed doctor. She talks to the doctor in English. Easy, super easy to understand. She explains what's going on. They ask her some questions. They say, okay, yeah, it sounds like you need antibiotics. They give her a prescription for antibiotics and something else. And the way they give us prescriptions is they send an email that has a couple of QR codes on it. And you take your phone to a pharmacy, which they're on every corner. There's pharmacies here. And all you do is you walk in, you show them the QR code, or the email with the QR codes. They scan it, they turn around, and then they hand you the prescription. There's no name on it. You don't wait. There's no filling the prescription. None of that exists. Total cost for the antibiotics and another like medicine to make things run better, right, was $11. So our total cost, 2 hours from, hey, I think we should go to a doctor, medicine in hand, was $40. $40. And that's without insurance. We're paying $1,000 a month for insurance, and it would have cost us more than $40 just for our prescription. Not to mention whatever our part of the copay was for the doctor's appointment. Not to mention however long it would take us to get that appointment. Man, they're doing something right here in Spain, I tell you what.
Hi. So, just a nobody here out of, 7-8 billion other nobodies. I've thought about doing this for a while, and every time my fire has gotten all amped up, something, I've calmed down, but today was a breaking point. The medical system has failed me since March of 2024, well before that, but that is when I actually started fucking documenting it. And today I get a call that my rheumatologist that I've been seeing for 5 years plus, that my insurance, because I'm disabled, my Medicare is not covered. They've known this for a year. I just had a J-tube put in 2 months ago. I just saw him last week. I am medically frail. I've been in 4 ERs in the last week because I had my J-tube come out. I've had 3 J-tubes put in, or 3 tubes put in the last week. I went 4 days without nutrition because I didn't have a J-tube. I had a messed up VSG bariatric surgery because the surgeon didn't educate me on all of the information that was appropriate for my medical condition. So I made a decision on a surgery without all of the information. So I lost 184 pounds in a year, requiring a feeding tube now to keep myself alive. So this morning I get this call from my rheumatologist's office saying that they have known since July of 2024 that my insurance, that it doesn't cover his office. So now I need to find a new provider. I can just find a rheumatologist. Like, let's be real here. One that's going to care, one that's going to give me consistent medical, and also, I'm going to find that in, 3 months, 6 months? Or I just change insurances. I can do that in the middle of the year. Now, I know there's options. I'm going to look into everything, the hardship stuff, and I am going to contact Medicare. I'm going to go through all the channels, but that's what I got at 8:14 this morning. A phone call. When a week ago, my J-tube came out, and I was in the ER Thursday, Friday, Sunday, and Tuesday, and finally got another tube put in. And no nutrition for 4 days because I had no J-tube. And all the ERs were like, you're not at a medically or an acute emergency, because I wasn't coding and I wasn't bleeding out on the floor and dying. So yeah, the fire is back and I'm done. I'm really fucking done. And I know I'm privileged, and that's the part that makes me so mad, is because I have insurance. I have coverage. And I'm so mad for all the people who don't have it, who don't have that safety net, who don't have advocates, who don't have people that are helping them, who don't have any of this, because they're being left to die. They're being left to just manage on their own. And I don't understand how this system is allowing this to happen. because people are doing everything they need to do. And it's fucking ridiculous. It shouldn't be this hard to stay alive. It shouldn't be this doctor passing you off to this doctor or this hospital passing you off to this hospital. People should care. Nurses, doctors, they should look at you more than just a checklist in the system and going, oh, well, your labs look fine, so you're okay to go. Other than, I was just in the hospital a month ago for a week because everything crashed. But yeah, let's just say, oh, well, this is fine now. You have no feeding tube and you haven't had any nutrition. And there's no fucking plan for you to go home with any nutrition. But you're not in an acute emergency. When I literally tell them I will be back in 24 hours because I have no nutrition and they still send me home. What do people do? What do people do that have no options? They go home and then they die. They fucking die in this system. And I'm lost. We have to do something, people. We have to make a change. We have to stand up. And I know I'm saying that as a disabled person that's sitting at home, that's hooked to a fucking feeding tube, but I'm documenting. I'm doing everything. I'm going to turn it in. I'm going to make contacts. I'm going to do all this shit. And that's what we have to do. We can't all be out there on the front lines and we can't all just be, I was going to say riot, but we can't protest. We can't all stand out and hang signs up and be there on the front lines, but we can all protest in our own way against these systems, against this bureaucracy bullshit. And I don't care. Maybe this is our revolution. Maybe this is our resistance. Maybe this is what we do in our own small ways. And this is mine. This is what I'm doing. I'm going to try to help. I'm going to try to do anything I can against this medical system. I'm going to try to help and get fucking people. I'm going to try to get the medical system to look at people again and see us. See us for more than just the charts and the codes and everything. So I know I'm a nobody again, but all of us nobodies need to stick together. We need to band together. We are so strong. We are so much more together than what we are separated. Please, we can do this. We can fight this. We can change the world. We can do this. We can save people. We can fight. We just have to. We have to believe in ourselves. And I know I can. If I can at 128 pounds with the fucking feeding tube and a computer, if I can do it, we can all do it in our own ways. So please, I'm challenging you. This nobody is challenging you. Be change. Do more. Be mad. No one's mad enough. And I want you to be fucking angry. That's my challenge to you.
I can't live like this anymore. Nobody cares about you unless you're dead or dying.
When I was 21, I sustained a back injury that left me paralyzed with pain. The slightest movement would send excruciating pain down my back, through my buttocks, and all the way down to my leg. I wasn't able to put any weight on this leg. I literally had to be carried from my bed to the toilet, and I needed assistance in the toilet at the age of 21. And of course, like most Americans, I didn't have health insurance at the time, so I couldn't afford proper medical care. I went to the local family doctor, and he did an x-ray, and he's like, oh, well, you're young and healthy. This is probably just an inflamed muscle. You'll be all right in a few days. Fast forward 6 months, I'm still in this excruciating pain, unable to walk. My entire life shut down. I quit my job because I couldn't work. I dropped out of college because I couldn't attend classes, and I was isolated from all my friends because I literally couldn't go out. When we eventually realized that this was a serious medical condition that wasn't going to go away with rest, we collected money to pay for steroid injections to reduce the inflammation on my buttocks where I felt most of the pain. And these injections were $500 a piece, and I needed 3 injections. Now I can walk, but I'm limping because I still have pain. So we decided to do physical therapy. Went to a physical therapist and found out that it was going to be $100 a session out of pocket. I was like, there's no fucking way I can afford this. She recommended me to go to a chiropractor, which was $25 a session. I was like, fine, We can afford this. I saw this man for an entire year. For an entire year, he kept doing these stretches on me, kept fixing my back, and every other week I would still be limping into his office. It took him a year to be like, hey, you know what? I can't fix you. You need to go see a surgeon. You need to see an orthopedic surgeon to find out what's going on. I think you might have a serious back condition. I go to an orthopedic surgeon. He tells me I need an MRI. I tell him, hey, I don't have insurance. How much is this going to cost me? He's like, oh, $1,200. I'm like, hey, I can't afford that. Can I go get an MRI from somewhere else? Can you write me a note? I'll go get an MRI and I'll bring it to you. He writes me a note. I pay $600 out of pocket to get an MRI. And finally, it's been 2 years at this point. 2 years after my injury, we finally find out that I have a herniated disc, which is putting pressure on my nerves. It's putting pressure on my spine, which is causing inflammation in my spine and causing inflammation through all the muscles throughout that nerve that runs down my right leg. So the surgeon tells me the only way to correct this problem is that I need to get a surgery done, which is called a microdiscectomy. Basically, they shave off a portion of the disc, which is putting pressure on my spinal cord. And this surgery costs close to $35,000 out of pocket. I tell him, hey, I don't have this money. What can I do? And he's like, well, you need to get insurance. And this is before Obamacare. So my only option was to get a job and work with excruciating back pain. And I'm like 23 at this time, almost 24. And the only jobs I can get without any work history or without a degree from a university is retail jobs. So I spent the next 6 months of my life standing, folding fucking clothes at Express and JCPenney so that I could get insurance so that I could pay for my surgery. Whilst I'm waiting to collect the money to afford my surgery, my doctor is prescribing me powerful painkillers. I'm talking Vicodin, oxycodone, Valium to help with my pain. These are highly addictive medications. They're made from heroin, basically, the same poppy plant. He was prescribing them to me like candy. I would run out. He wouldn't ask another question. I would go in for my weekly or monthly visit. He would just write me another prescription. He's prescribing a child Vicodin. And of course, I got addicted. I got addicted to these pills. I found myself popping these pills in moments where I didn't have the pain. I just took it because I had the fucking craving for it like a cigarette. When I finally, first of all, become eligible for my health insurance, because it doesn't kick in right away, after months of working and collecting money, not spending money on anything else, just literally just saving money for my surgery, I gather the $6,000 surgery copay that I need to get this surgery done. I get my surgery scheduled and I go to my boss and I tell her, hey, I need a month off of work because I'm getting a major back surgery done. She tells me the best I can do is 7 days, which is 5 days that I normally am scheduled to work, plus the 2 additional days off the week that I get. So the best she can do is 1 week. And I shit you not, 1 week after my surgery, I'm working at JCPenney and I'm bleeding through my shirt because I'm not supposed to be on my feet. I'm bleeding through my shirt and my manager goes, hey, there's some blood on your shirt. Go take care of that. And by this time, I'm 24 years old and I get my surgery done. And through that, thankfully, I regain my mobility, but the pain has never gone away. I still, to this very day, I'm 36 years old. I have pain every single day. Every single day of my life for the past 15 years has been in pain. Fast forward 3 years, obviously I quit that job and I have a new job as a graphic designer for a much bigger company, and my injury is flaring up. I'm having trouble sitting at my desk, so I need to take some time off work. I wanted to apply for short-term disability. I went back to that surgeon, right? And I brought the form with me that my company was 100% okay with this. They're like, yeah, we can see you're hurting. Go get this form signed by your surgeon. I take this form to my surgeon and he looks at me and he's like, I don't believe you. I don't believe you're still having pain. We did the surgery. You should be completely fine. You're young. You're skinny. There's no way you're having this pain. And I was literally speechless. I was like, listen, my company has already approved this. All I need is for you to fill out this paperwork that says I have a serious medical condition. I don't need anything else from you. As soon as he gave me the paper with his signature, I stormed to the front office and I told them to give me every single medical record they have of me, and I never fucking want to see this doctor ever again in my life. I've spent half my fucking life in pain. You don't know what that does to a person. Like, I want to go out, I want to explore the fucking world. I want to see everything that there is to offer. And some days I wake up, I can't fucking walk. And why do I have to live my life like this? It's the worst feeling to try to explain to somebody how much pain you're in and they completely fucking dismiss you. 15 years, bro. You don't know what what that's like. I was a child. I was a baby. My entire life has been ruined because I fucking had the misfortune of being in this fucking country that doesn't give a shit about its fucking citizens. Even as I'm sitting in my car right now talking to you guys, I'm in pain. And I've accepted I'm never going to wake up and jump out of bed and be totally okay and be ready to seize the day and be excited for what the day brings, because I'm always going to have this pain. If we had universal health care like most developed nations of this world, I would not have to live my life like this. From the moment I experienced the first sting of pain, I could have gone straight to the doctor and be like, hey, there's something wrong. We could have done the tests. We could have done all of the tests that I needed. If I had the proper care when I first sustained this injury, I would have never needed surgery. I would have gone straight into physical therapy. They would have helped me manage my pain, and I would never, ever be in this position. My entire life was ruined at the age of 21 because of the fucking healthcare system in this country, and my story is not unique. I'm not unique. This happens to millions of people every fucking day, every year. And our masters don't give a fuck. The healthcare system in this country is made for profit. It is not about caring about the health of the citizens. It's about squeezing every drop of money, that every dime that a person has.